So there are some agents or drugs that can basically what stimulate erythropoietin. Okay, and erythropoietin is that hormone that is secreted to what oversee the process of what erythropoiesis, which is the process of red blood cell formation in the body. So there are some agents that can be used to stimulate the actions of this erythropoietin, and they are called what the erythropoietin stimulating agent. That's the ESAs. Okay, so since they are stimulating erythropoietin, that means if you have red cell deficiency anemia, that means like an anemia where the red blood cells are being reduced, you can give this erythropoietin stimulating agent so that what erythropoietin is stepped up and the production of red blood cells is stepped up and all that. Okay, so we are going to discuss how we can be able to use this erythropoietin stimulating agent to treat red cell deficiency anemias. So moving, one of the agents, the most popular one is called what Epogen, also called what epoetin alfa. Right, so we'll be looking at talking about their use is just you basically looking at their mechanism of action. Okay, so red cell deficiency anemias are most commonly treated with what erythropoiesis stimulating agent. Okay, erythropoietin stimulating agent, erythropoiesis stimulating agent is still the same thing. Okay, the most popular one is Epogen, okay, and many others, right? But for students, mostly they just state Epogen and that's all, okay? So what are the properties now? Epogen is a glycol-epoetin that is produced mostly by the what? Okay, sorry, erythropoietin. Sorry, you know they actually abbreviate Epogen and erythropoietin the same way, so it's actually somehow confusing sometimes. So erythropoietin now, we're actually heading to a point. Erythropoietin is a glycoprotein that is produced mostly 90% by the peritubular cells of the kidney. Alright, so erythropoietin is essential for the normal reticulocyte production. It's essential for red blood cell production. Okay, so synthesis of this erythropoietin is stimulated by hypoxia. When you have reduced levels of oxygen in the body, then erythropoietin will step in so that red blood cells will be produced so that what more hemoglobin will be available to transport more oxygen. Do you understand? So now, this erythropoietin is available as what? Recombinant human erythropoietin. Okay? And it's also available as what? Epoetin alpha, that's the Epogen that we have here. Okay? And it's also available as what? Darbepoetin. That's like the synthesized erythropoietin that is being produced by the kidneys, so that if a patient is lacking it, you can give it as a drug. Okay, so now darbepoetin is a second generation erythropoiesis stimulating agent with a half-life about twice that of what epoetin alpha, so it will last longer than epoetin alpha. So it is administered parenterally, that's through what intravenous route or the subcutaneous route of drug administration. Okay, you see erythropoietin basically act what on the bone marrow, that's the site of red blood cell precursors and their what erythropoietin receptors, and this will increase red blood cell production. So in here we just spoke about the synthetic forms of what erythropoietin, which include what recombinant human erythropoietin, epoetin alpha, and the darbepoetin. These ones can be used as well drugs to basically what correct when you have reduced levels or reduced count of red blood cells in the body. So this is using what erythropoiesis stimulating agents to treat red cell deficiency anemias. So that's the bye for now.